So sperm DNA fragmentation has emerged recently um, in the armamentarium of evaluation of male factor. Conventionally, it used to be WHO semen analysis, where we check the concentration, motility, and normal shape sperms. But clinically, now sperm DNA fragmentation tests are available, although different clinics do them slightly differently. And there are 2 or 3 assays which are available in the market with their own pros and cons. Uh, Usually, the general consensus is that it is still not a mainstream must male factor test yet because of the limitations, although in certain cases it has got advantages and we can assess the function of these sperms more closely over the time, specifically if somebody is modifying something which is modifiable in their case with low semen parameters, and we can see whether that has improved or not. So basically, sperm is a complex cell and it contains a compact DNA which is affected by lifestyle, environmental toxins, diet, and different other things. And it can lead to fragmentation or breaks within the DNA. Um, and this has translated into uh, either difficulty in conceiving the female partner, or there is now a role that if there is high DNA fragmentation or more DNA breaks in the sperm, then it leads to uh, problematic integrity of the sperm, and it can also translate into more chances of miscarriages because obviously the embryo is 50% of the genetic component of the male as well. Previously, we used to ignore males, and just a simple semen analysis was sufficient for them to rule out normality or rule out abnormality or diagnose normality. But now more and more focus is on male health and into the sperm microstructure and genetics. So we have now learned that yes, sperm DNA damage can lead to problems, and we can clinically are able to test this by doing these DNA fragmentation tests. The common assays are tunnel assay or comet assay. Again, there are pros and cons for both of them. The main limitation is that the sperm sample, which is used to check the DNA fragmentation, is not the sample which is used on the day when we use it. So it could be slightly different. And we know that the sperm parameters are very variable in a single man with different timings and different physiological conditions or under different lifestyle factors. So the problem is that the so the sperm sample which is tested for DNA fragmentation is not the sample which is used in assisted conception. It is a different sample. So the reproducibility is also an issue. Um, and then standardization of the lab assay is also problematic. It is not universal. That is why probably it has not been universally adopted by all the clinics. But obviously, the clinics who have researched it and they have standardized their assays, they have got more robust, meaningful results. Um, it is an addition into the diagnostic tests and knowing more about the sperm health, but it is not must, I would say.